Nursing for all. 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 Nursing for all.
Here, and you notice I came in from this side. Is also the side that the doctor will come in when he's scrubbed for the procedure. So I'm going to place the things that he's going to need over here in reverse order that he's going to need them. He will glove last, so I'm going to put his gloves on here, this time with the label, with the writing the right way up, because we were going to gown him differently than I gowned myself. Then the gown and one of the towels, because he will come in and, of course, dry his hands, don the glove, and then I will assist him in putting on his gloves. Our last step before beginning the procedure is having the scrub tech gown the physician as he comes in from completing his scrub. For the purpose of this demonstration, Mike will take the part of the physician and I will demonstrate the proper gloving technique for the physician. So Mike's coming in with his hands up just as we've done before. I'm going to hand him off a towel and he can dry his hands in the manner we've discussed. When he's done drying his hands, he can discard the towel. And I'm going to hand him the gown. Notice that as I hand him the gown, I put my hands inside the gown so that as I hand him the gown, he can put his hands inside without touching my sterile hands. We have a gentleman here that's going to act the part of our circulator and scrub and tie up the back of the gown as a circulator would do in an actual procedure. Now I'm going to demonstrate gloving the physician. I have the gloves toward me, and the writing is right side up in this case, and they are marked right and left. I'm going to take the physician's right-sided glove, open the cuff up, and make sure that the thumb side of the glove is towards the patient's, the doctor's side. Put my hands on the outside with my thumbs out so they can easily slip his hand inside the glove without touching my gloves. And you'll notice that the physician, unlike the technique, the closed glove technique, has his hand outside the sterile gown. We'll repeat that technique. Again, the thumb side toward his thumb side. My thumb's away from his as he slips his hand inside the gown. The last thing we do to prepare the physician for the procedure is wrap his gown. Now that I have sterile gloves, I can actually take his string here. He can hold the other one. He can turn so that he is completely wrapped, so that when he walks between the two sterile fields, he is also protected front and back. This completes our pre-procedure setup.